Hello and welcome to the webinar. Today we will be presenting Evaluating Your Practice's Financial Health. This is the 10th installment of our educational webinar series, and we hope you find it as useful as the others have been. My name is Jeannie Logue, and I'm the Marketing Communications Coordinator for Itentive. I would like to take a moment to explain the process for today's presentation. First, I would like to mention that this webinar will be recorded. At the end of the presentation, we will open the floor up to questions from you. We will answer all the questions at the end, but you may type them in the questions area of the webinar control panel whenever they occur to you. Finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box and let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I would like to introduce our presenter today. Jeannie Logue is the Director of Managing Consulting at Itentive Healthcare Solutions. With over 25 years in the IT healthcare industry and almost 4 years at Itentive, her experiences and expertise are noteworthy. She is frequently a speaker at both MGMA and NextGen events and travels across the country seemingly nonstop, working with our clients at their locations. She truly does live and breathe the industry. So Jeannie, I'm going to go ahead and pass the webinar off to you. Feel free to get started when you're ready.
So today we're just going to focus on the financial health of the practice, and have you had a chance to really check that lately? With EHR implementations, upgrades, meaningful use. So today we're just going to focus on the financial health of the practice, and have you had a chance to really check that lately? So what we're going to do is we're going to look at, how do I know? What do I look for? And what do I change when I start finding some things that are maybe not in the focus that we want them to be or on track? So how do I know? NextGen contains many basic reports. There's a lot of reporting in NextGen, and there's many basic reports that can give us a quick pulse of our overall financial health. We're going to focus on a few of them today. Once we do that, then we'll get a quick pulse, and then we'll dig a little bit deeper. So a couple of the reports we want to look at today are calculating our days in AR and our percentages. Take a look at the payer mix, our net collections, our unapplied payments, balance control, and then look at our statements and our statement counter and make sure we have a good handle on those as well. So the days in AR report is a pretty simple report. You're going to do your monthly changes in AR report and then just do a simple calculation of days in AR. And your days in AR are your net AR balance divided by your monthly charges, and then you're going to multiply that out by your days in the month. Now we have working days in the month and we have actual days in the month, so you can use either one of your calculations and you're going to get a similar result on whether you want to use a true 31 days in the month, and you're going to do your calculation by that. Some national statistics from the MGMA right now are the average days in AR ranging anywhere between 35 and about 38, 39 based on specialty. So again, if you calculate your monthly days in AR, you can kind of base it on the national average out there. The insurance aging analysis report is another report you want to kind of run on a high level and take a look. So I go ahead and put that one on here. The insurance aging analysis report reports accounts receivable, collections, and then insurance aging analysis. Go ahead and to get a true AR on this one, you're going to want to filter by date of service, not by first bill date or last bill date, but the true date of service is going to give you a true AR data. And then go ahead and export it to Excel and do just a simple calculation to see what's my percentage in my 0 to 30 days of my true net AR, what's sitting out there. And on this one, we show that like 57% is in the 0 to 30 days. And you can do a quick, simple percentage based on each bucket on how well you're doing on keeping your buckets cleaned up and getting your claims paid quickly. And then the total percentages of AR in the 0 to 30 days, again, national average on this is around 55% should be sitting in your 0 to 30 day bucket. And then the total percentage of AR that's greater than 90 days, the national average is around 23%. So you want to try to keep everything into the 0 to 30 days as much as possible. The next report we want to take a quick look at, and I did go ahead and give you all the columns on this report, is a payer mix report. And the payer mix report is just a monthly transaction by line item summary, and go ahead and click on all the different columns that I have, but understanding your payer mix, the percentages by your charges, by your payments, by your adjustments. We often look at, I think I'm 50% Medicare, in my payer mix, and then we look at it and it's 30%, or it's 50% in charges and 30% in payments. So what I did was, again, ran this report, exported it out to Excel, and then just added a percentage column to take a look. My Blue Cross Blue Shield, based on how many count, and that's my charge count, I'm at 36%. But then on the charge amount, my percentage is 47% of my payer mix is Blue Cross Blue Shield. And then you can do that on adjustments and payments as well to just get an understanding of your payer, your financial classes, and your payer mix, and how your payer mix is based on charges, adjustments, and payments as well. The next report is your net collections report. This is just a practice next collection. It's your AR report, receivable analysis by month. This one we're going to go ahead and make sure we filter it by aging dates by process date. And this is, you want to go ahead and include your historical data on this one as well. And this is a charge-based report. So when I say a charge-based report, this is going to go ahead and break down all your charges per the month. So if I have a date of service that was in March, but I didn't enter the charges until June, it's going to be in my June month. It's not going to sit in my March month. It's not going to run by date of service. It's the date that you processed it in NextGen. Again, this report is a nice report to say, how much did I put in charges for that month, how much have I received in my third-party payments, my patient payments, my third-party adjustments, and my patient adjustments, and what's my net AR still sitting out there. Again, I exported this one just out to Excel, and I ran a last column here on percentage, and I wanted to look at, what do I still have out there to still collect for those previous months. This is, again, a high-level report, and if I think 11%, from February is still quite a bit out there, I can drill down and further into other reports and look at why do I have 11% still out there. Now, this is going to include your patient balances out there if patients are making monthly payments, and that could be a big portion of the 11% could still be patient balances out there. The unapplied report is just the practice unapplied report, and this should be ran on a regular basis looking at account versus account encounter unapplied, and make sure that you're keeping this one cleaned up. The unapplied report, you absolutely do not want to filter out your dates. A lot of times we'll go in and look, and people will be looking at unapplied for just last month or unapplied for last week, and then the unapplied is sitting out there from previous months. So don't filter out your dates on this one at all. Keep it cleaned up. Unapplied payments will impact your financial reports. There's many reports in NextGen that you can exclude unapplied or include unapplied, but some of the high financial reports like monthly changes in AR, it will include your unapplied out there. Patients will also receive statements if they make their copayments when they're in the office and you put the copayment out to unapplied, but it doesn't get pulled back into the charge screen when charges are entered. Patients are going to still end up getting a statement when their unapplied payment is out there to be pulled onto the charge screen. So keeping the unapplied cleaned up is going to save you all kinds of financial headaches and patients receiving statements when they've already paid their copays on the date of service. Balance control is another report that we look at when we're doing kind of a financial overview. Many times in NextGen we have accounts that the account balance is equal to 0, but we have a credit or a debit in our offsetting buckets. So there are a couple of different reports that we can use. I like to look at on the high level, on an account level of these versus on encounter level. And I've given you a couple of reports that you can run on this. The first one we're going to look at is a report. It's accounts receivable, and on the columns tab, we're going to go ahead and I've listed out the columns that you'll want to include on this report. And then the first report's going to look at under filter 2, we're going to go in and look at patient amounts that are not equal to 0, but my account balance is equal to 0. So what this is going to look at is anybody where I have a patient that is probably receiving a statement, but I've got an offsetting credit in one of my insurance buckets. And then the second report that I've listed out here that you can run is going to look for insurance 1 is not equal to 0, my patient balance is 0, but I probably have an offsetting debit and credit again in my insurance 1 and my insurance 2. So the way these reports are going to look when you run them, the first report here is going to show I have a patient of a credit of $72, but I've got my insurance out here that still owes $72. So these again are reports that they could be out of balance. Now I truly may owe the patient $72 back, and someone's going to have to take a look to see, is this just an out of balance account? Or do we owe the patient $72 and we're still waiting for the insurance to pay? Normally they're just an out of balance account and someone needs to go in and just clear up the account on this one. And then the second report is basically a similar report, but it's looking for offsetting insurance. The 122 is insurance bucket 1, still showing on my AR that I need to collect that 122 from insurance 1, but I've actually got a credit in my insurance 2. These happen a lot when we see manual posting, that we get these offsets on the account. So it is going to make your AR reports inaccurate and not up to date until you clear out these balance control issues. Statements and patient collections. I like to run a statement report just by the reports, accounts receivable, collections, account summary. And I like to sort it and group it by my statement counter to determine how many statements am I sending out on patients that have a statement counter greater than 3. You want to do just a total report on this, high level again, take a look at it and see, and count by your account IDs, which is going to tell you how many patients have received that many statements, and then sum your account balances to determine exactly how much you have out there that you've sent statements out. So in this example here, I have 41 patients that I've actually sent 7 statements on. My account sum is $2,800, but I'm continuing to just send statements out and the patients are not making payments. So this gives you a high-level view. Am I just continuing to send statements out? I need to move these patients on to collections or bad debt, or look at the balances and are they small balances and do I need to write them off? Now the statement counter itself and how it works in NextGen, if you're familiar with it or not familiar with it, the statement counter is actually a nice feature because anytime the patient makes a payment, and it's a transaction code of a patient payment, it will reset the statement counter back to 0. So it is a way for us to monitor whether patients are making payments or not on their account. Now it is any patient payment, so if you have a patient who has a large balance of $300-400 and they're making monthly payments and they skip a couple of months but they come in for a visit and they pay a $20 copay on today's visit, it will reset their counter back. So NextGen has given us the ability to, under practice preferences, to determine when we want this to reset. Maybe we don't want it to reset with a $20 copay. So you have 2 options in practice preferences to say what a minimum flat dollar amount would be, and we usually recommend that you set this to at least maybe $40, $45. That way it's not going to reset on the small copays that patients may be paying when they come in for a new office visit. You also can set it to an acceptable percentage. So if your practice says, well, we accept, a 10% is our minimum payment that we want from a patient based on their balance, you could set this for a 10%. And as long as the patient makes the 10% of their total balance, it'll reset their counter back to 0 again. Now, patients that have very large balances and you're willing to accept, smaller payments, $25 a month, and that's not 10%, their statement counter would continue to go up. You can monitor that on your report and then just manually reset them if you feel the payment that they're making to you is acceptable. And then, take a look at how many times are you sending out a statement on a patient with a balance under $50? So the other thing I would do is monitor your small balances. Make sure that you actually are not sending statements out to patients for under $50 multiple times month after month. So what else do I look for? There's a couple of other audit reports that I would recommend that you run on a regular basis. Keeping an eye on your advisor, and we'll take a look at that. How do I close the gaps? And then understanding the life cycle of an encounter as well, I think, is real important. So a couple of audit reports that NextGen has always recommended that we run is the unbilled encounter report with charges and without charges, an EHR pending charge report if you're doing EHR EPM crossover, and an on-hold report. Encounters can be placed on hold for further review before you send out the claim, and we're just going to review how to put an encounter on hold and then how to monitor anything you've put on hold. On the audit reports, the first one is the unbilled encounter report, and I know that this one is recommended that we run this one all the time. What I find all the time when I'm working with clients is that they filter out the dates. That I'll go in and we'll look at, okay, I have my unbilled encounter report for last week, or I ran my unbilled encounter report for yesterday, but no one's historically looking at, I ran it for last week and I had 12 unbilled encounters, so now I'm looking at this week and those 12 are still sitting out there. So we'll go in and we'll run it, and we'll run all to date, or we'll run it all to date, just maybe 2 days ago, because we know we have charges that are still pending from 2 days ago, and we'll find all kind of encounters out there that have very large aging dates. And if you look kind of on the screen, we've got some out here, 184 days, 188 days. So you don't want to filter your unbilled encounter report. You want to make sure that you are looking for anything that's aging out there that we've created an encounter on and we have not put a charge against it. It's missed revenue. And the kept appointment no charges is the scheduling report, again, similar to the unbilled. The patients walked in the door, we've checked them in, and I have no charges linked to them. Many times I see this report also was ran just looking at yesterday or last week, and no one's running it kind of historically looking at all the appointments that were kept with no charges still out there. So you want to make sure you filter that one with the all-to-date, or the beginning date is from the first time that you started on the system or until you keep it clean. So those are 2 reports that really would need to be monitored because they are missed revenue if someone's not watching those reports. The on-hold report is a report accounts receivable unbilled encounters. So it's looking at your unbilled encounters, but you can put an encounter on hold. So if I accept charges over from EHR pass-through, and when I'm looking at them, I want a coder to look at it, or I'm missing an op report, or there's some reason I just really do not want to send that claim out the door yet. I always ask, how do you put that on hold? And many times I hear, well, I go into balance control and I just remove the green check mark. Well, that will keep the claim from going out, but there's no way to monitor that you've removed that green check mark, and that claim may never go out the door unless somebody remembers to go back in and into balance control and add the green check mark back in. So the correct way to put a claim on hold is under the encounter maintenance screen. There's a tab, the billing and collections tab, and there's actually a hold date that you can enter I want to hold this until this specific date. Now once you build the encounter the first time, that hold date goes away and you cannot put a rebill encounter on hold. But the hold date will, if you put it out for about 10 days or 2 weeks, it will not send that claim out. But if you forget to go in and actually remove the hold date, you've cleaned it up. On that date, it will release that claim, and it will send it out the door. Whether you've touched it, changed anything, cleaned it up, it will release it on that hold date. So you always want to watch, if you allow the staff to put things on hold, you always want to monitor on a high level what has been put on hold. How much do I have out there that someone's put on hold? And you want to look at that. Again, that's going to be future dates because you're looking at the things that are on hold in the future. So you can look at what's on hold for next month, or is going to be released next month if you allow your staff to put something on hold. The EHR pending charge report is another report that, if you're accepting EHR charges through to EPM, many times everybody's bringing those charges over, but no one's going back and running the EHR pending charge report. It's just reports general EHR manual charge processing pending. What we see all the time in here is, again, missed revenue. If I have a patient who comes in for an office visit and then they have a couple of labs and maybe an ultrasound, if my physician submits my office visit over, my charge entry people bring my charges over into the system and we bill the claim out, it's no longer on my unbilled encounter report. It's no longer on my kept appointment with no charges report because I've billed out a charge. But what happens is those 2 other charges that get submitted at a later date, because the nurses or the MA finished up the next morning, they're submitting over labs and they're submitting over ultrasounds, but those charges are never pulled into the charge screen, and it can be missed revenue. So going into the EHR pending charge report, monitoring this quite often, actually I recommend daily if not weekly, and looking for charges that are additional charges that may have got submitted at a later date, and make sure that those get billed out as well. The advisor screen, I often see that no one really looks at their advisor screen. They don't have it popping up. So we're going to kind of look at why you should at least, pop it up once a day and at least take a quick glance at what's on it. It will give you a days in AR calculation, and that calculation will vary based on how you have it set up in your practice preferences, because you can do it on date of service, last bill date, first bill date. Again, it is an estimate. I would still calculate your days in AR by your reports and your true data, but it will give you a quick glance on your days in AR. It'll show you if you've got unbilled encounters out there, and if there's claims pending, electronic claims or paper claims, and there's system support things that you can see on that advisor as well. So here's what an advisor, and I kind of pulled everything that's on your advisor out. These are the things that I would recommend that you at least, pop up in the morning, take a quick look at it and see. Do I have claims that are not processing? I have paper claims here. There's 235 of them that I need to print out, and I've got electronic claims, 288. If you thought you processed everything, then, these should be very minimal. And if that keeps growing on a daily basis as you're processing claims, then you may have an issue with something's getting stuck in the system and not going out the door that you think is. Your pending statements, how many statements do I have to send out? And we'll talk a little bit about how often you're sending statements, but that's going to calculate every day and it's going to grow. Now this is a once a day, it updates first thing in the morning. You're going to have new data to look at, but take a quick glance at that. Did I process statements yesterday? Do I have a lot of statements that still need to go out even though I processed statements yesterday? Unbilled encounters, again, that number keeps continuing to grow. So if you're working your unbilled encounter report and you think you have everything cleaned up and all your billing is done and that number continues to grow, we would dig a little bit deeper and see what's going on with the system. And then down at the bottom, when I talked about your quick glance days in AR, again, it's an estimate on your days in AR based on how you have it set up, but it will give you an idea of if you're sitting in a range that you want to be or a range that you really don't want to be, and you need to look at how we can reduce that days in AR. And then the last thing is the system index issues. If there's missing indexes or incorrect indexes or store procedure issues and you're seeing any number on that system support here, like I've got a 1 and a 5, those indicate that there's some kind of issue with your store procedures. And sometimes these can cause issues on your financial reports, and your financial reports can have issues with not being completely accurate if those are not cleaned up. So you always want to report those to NextGen if you're seeing anything on your system support there. So the last thing we want to kind of look at is how do I close the gaps? So we talked a little bit about encounters and unbilled encounters. We want to make sure that you bill all those encounters out. Don't lose any revenue. Billing in the claims, we're going to dig a little bit deeper on do I have missing claims in the system and how do I find them, and how you follow up on denials, and if you're using insurance verification. So with the encounters, we talked a lot about already, the unbilled encounter report and keeping it up to date. But if what I find often when I talk to clients too is that they'll say, well, I run my unbilled encounter reports, but that one's a duplicate, and this one I know, and this, they know why they're still on there, but they've continued to leave them on the report. So what we recommend is if you don't have SIM codes to move these encounters into history status, go ahead and set up some dummy charge codes. Now, you can suppress a duplicate encounter. I do have clients that say, okay, well, I kind of want to delete it. It really just suppresses it. But there's a lot of steps to suppress it out of the EPM and get it off the unbilled encounter report. You have to back out the insurance. You have to unlink the appointment if it's linked to an appointment. So many times we just create, a code that says patient left without being seen. We check the patient in, the wait time was too long, and the patient ended up having to leave, and the physician never saw the patient. If you don't clear out that encounter, it continues to sit as one of your unbilled encounters, and it continues to be on that report, forever and ever. So we want to go ahead and enter a dummy charge and clear it out and move it to history status. And we can do the same thing with duplicate encounters. In the billing and the claim process, I've actually encountered this multiple times where, I'm billing every day. How can my, encounter billing claims continue, I've got extra ones here and they're not going out. Well, the first thing we look at is if you're not running your claim request or your encounter bill through the BBP, someone is manually doing it. Is that person's user preference set too low? I've came in and we've looked and their encounter lookup is set at 500, but they have 800 encounters a day that they should be billing. Well, each time they do that and it gives them a lookup limit of 500, they're only pulling 500 instead of the 800. So we always want to make sure if you're doing any kind of manual billing or claim lookup that your lookup limits are set high enough that you're actually going to be able to see or process everything that's in the system. And then we'll take a look at pending claims and dirty claims. On the claim icon, and I kind of like to look at the claim icon or the claim as I look at it as your claim kind of a holding tank. When I run all my encounters through the encounter billing, it moves them all into this claims processing, my term, holding tank. And at this point I have to determine, okay, am I going to create my 837 EDI file and send these out electronically, or are these going to be dropped to paper? Many times I see that we go and we take a look at this kind of holding tank or the claim and we don't really, no one's really monitoring that. So by hitting the claim icon, doing your claim request lookup and look at what's in there and pending, you can often find things that are just kind of what I call stuck in the system. We thought they were going out, we didn't know this was a problem. So we want to make sure that you take a look at what's in there. And the media type, it's basically states MT when you do a lookup. If you flip that, you can look and you can see we've got P for paper claims and E for electronic. And what I find many times is a client will say, well, I don't send paper claims. My clearinghouse sends my paper claims. Well, that's great. They'll send your paper claims, but you got to get it over to them electronically so they can drop it to paper. And many times we find a whole bunch of paper claims that are just stuck in here because if you go into file maintenance is set up to say, drop the secondaries to paper. So the system is going to drop them to paper, and we need to go back and change that media type to electronic to allow these claims to get out the door to the clearinghouse so the clearinghouse can drop them to paper. So watching those two things, do I have paper claims that are just stuck in here and nobody is printing them out? And then the other thing we look in here is the condition of the claim. The condition of a claim is a clean claim, and then it's going to go ahead and print on paper or it's going to go electronically. But if I have a dirty claim in here, the dirty claim, again, is not going to go out the door. It is never going to create on your EDI file. It's just going to sit in this holding tank as a dirty claim. So you want to go through and you want to look, do I have dirty claims in here? Open them up. Have I created a clean claim and got it out the door, or is this the only one that's sitting here and that claim has never actually ever went to the payer? Dirty claims are usually created because somebody manually runs the encounter billing and then forces a dirty claim. When it says, do you want to create a claim, and you hit yes, it's going to create it whether it's dirty or not. And a dirty claim is one where your claim edits are read and you haven't fixed it, but you forced it to create the claim anyways. And there are times that we do create a dirty claim because we want to send it out for timely filing and get it out the door. The next thing we're going to look at here is denials. Review your denials closely to eliminate root cause. Denials, it's recommended best practices that somebody is touching this within 24 hours of when you've received the denial. Utilize your reason code subgroups to trend and analyze your denials within NextGen. Get denials to the right team quickly with tasking. Per the MGMA, each denial costs approximately $25 just to rework that denial. So a couple of denial reports that are just quick, easy reports to run is just reports daily, line item, and then reason codes by adjustments, and then the same code but reason codes by payments. Now the examples I have here is we have used the reason code subgroups, and then we've taken every one of our reason codes, timely filing, additional information required, so all the codes that are linked to additional information, we bundle them into those subgroups so that we can go ahead and trend, what are my top denials? I mean, what do I need to work on? And what I always recommend is then work backwards. If my top denial is additional information required, what payer is asking for additional information? What can I do on the front end to get a clean claim out the door? Are we billing something that an op report is always required? And how do I work with that payer to say, okay, you've always won an op report. Let's send the claim the first time clean versus always working it on the back end, waiting for that paper to come into our office that says, oh, we need to send the op report, to get this claim paid, because you're just, delaying your payment and extending your days in AR. Insurance verification, whether you're utilizing NextGen's RTS or another resource right now, verifying patients' coverage is very important nowadays. Patients' insurance is changing month to month, visit to visit. And if you don't have any kind of system set up right now for insurance verification, you want to look at whether you're going to use RTS or one of the online systems or directly to the payers. But you want to make sure that somebody in your office is doing insurance verification on your patients for clean claims. It is one of the top rejections from your clearinghouse. These won't even go to the payers. Most of the time your clearinghouse is going to kick it back on your daily rejections as eligibility issues. So just establish a workflow to guarantee that insurance is verified before or during the patient's visit to make sure that you have clean claims. This is just kind of a broad overview of the life cycle of an encounter. A lot of times what we do is take an encounter and we look at the little gray screen that's on that encounter, and there's a lot of information in here that I find people didn't realize it was all in that one little box. Your encounter date is the date that we created the very first encounter. I mean, we created that counter. That's the day we created it. Whether we put charges in or not, that's the date we created it. The first bill date is the date that I actually process it in NextGen, and I'm processing my encounter bill, and I'm running it through the billing cycle. So I'll get my first bill date. My last bill date is the last time that I ran it through the billing cycle. Whether I flagged it to rebill to the primary, I billed it to the secondary. My last bill date can change though. It's going to be, so if I go ahead and bill my primary and then I rebill my primary again and now I'm rebilling my secondary, my last bill date can change often. So just make sure that you realize it's not going to give you the in-betweens if you've rebilled that one multiple times. The encounter status on here, we have billed, we have unbilled, billed, rebilled, and history. Encounters can go into history status and they can come back out of history status into a rebuild status again. They can never go back to an unbilled status though. The statement counter is on here as well too. So if you want to know how many times this encounter has shown up on that patient's statement, you can go ahead and look at that really quick on the encounter. You don't have to always go up to the account level and open up statements and start looking at it, which I see often. You can just say, oh, this encounter was on that statement 7 times. The patient responsibility date, what date did we flip this encounter over to the patient for their responsibility, is on here as well. Now the one thing to note is patient responsibility will not age. So if you're running an aging report with patient balances on it and you look at this and it's still in the 0 to 30 days, but it's from September of 2014 and you're trying to determine why does it still show that the patient responsibility is 0 to 30 days, if there's any balance to the insurance on any other line item, the entire encounter will not age until all line items are out to the patient. Then it will start aging the patient. It'll still flip that portion of it to the patient. The patient will receive a statement every month. It just won't actually age it on your aging report until all line items are out to the patient. And then historical reports. If you're running a lot of reports, you want to make sure that you actually mark the history. So this is on your filter 1, and it's the charge status. So understanding your charge statuses. Do I want to see things that are in billed status, rebuild status, unbilled status? Do I need to look at some of my history stuff? And I often find that we look at reports and we're running historical reports, but we're not pulling the history and counter status, so we really don't have accurate reports. So what do I change? The first thing is review your processes. How can we work smarter and not harder? We want to maximize the automation and then review the setup in NextGen. What else can I set up in NextGen? And we'll take a look at those. So as far as reviewing the processes, I recommend you always do a walkthrough when you want to look at your financial health. Do a walkthrough of all processes. Start from the very beginning of scheduling. Am I collecting insurance information at scheduling? Am I doing my insurance verification at scheduling? Do your check-in and check-out process. Do you have auto flow set up? Are they touching everything that you want them to touch on check-in and check-out? The eligibility check. Who's doing the eligibility check? Often we see, well, sometimes it's the authorization team, sometimes it's front desk, sometimes it's, the nursing staff. Who's doing the eligibility check? Make sure that you have a solid process on who is responsible for that. Co-payments and payments on account. Are you collecting all co-payments that you can on the date of service? Do you have patients that have need to make payments on account? Does your front desk know that they have patients that have balances on account? We can add, patient balances on your scheduling report so your front desk knows that they should be collecting. We could set up alerts that pops up when they go to schedule that patient's appointment. They're reminding them that they have a balance on their account so that everybody in the office is trying to collect on the account. Charge entry. Who's doing your charge entry? Are you using an auto flow for charge entry? Are you making sure that that person has a batch open and that they're pulling your unapplied? So your process of charge entry is kind of who. Are they completing the process and everything is being cleared out of the holding tank in the EHR system, and they're monitoring that to make sure that there is no missed revenue. Claim edits, reviews, and claim processing. Do you have all the edits turned on? The easiest way to find out whether you need to turn new edits on, and we'll look at that, is your rejections from your clearinghouse. If they're rejecting them, what can we set up in NextGen? Payment posting. How are you doing your current payment posting, ERA or manual? And then denial management. We'll dig a little bit further here into that. So maximizing automation is the first thing. Work smarter, not harder. Just set up the auto flow check-in, check-out. Make sure that they are touching what you want them to touch when they're checking in those patients and checking them out. Payment posting, ERA versus manual. If you're not posting the majority of your payments ERA right now, you want to explore that. You want to contact the insurance companies, contact your clearinghouse. They'll let you know which payers are accepting ERA and EFT payments, and you want to make sure you maximize that. There's so many benefits to ERA posting versus manual posting. The BBP. If you're not currently maximizing your use of the BBP, you can do batch posting and counter billing, claims processing, statements, and reporting, daily reporting, monthly reporting. If someone's coming in every day and they're just running a report, run the report for them. Have it emailed to them first thing in the morning so they don't have to do that process. Utilize your BBP. RTS for insurance verification. Again, if you're using it or not using it, it can be added into your auto flow now. It's a piece of the auto flow check-in. The RTS is just a function. You can have it pop up. If it's already been ran, it'll give them the result. And if not, it'll force them to run RTS right there on check-in. Check with your clearinghouses. If you're manually auto-uploading or auto-downloading your 835 files and sending your 837 files, and someone every day is like going to the folder and uploading that, check with your clearinghouse. Many of them have the ability to auto-upload and auto-download those for you. You just create a file on your shared drive, and they'll actually just grab your files for you and dump the new ones in there. And this will save you a lot of time with going to the clearinghouse and having to manually download those files. And then tasking and EPM work log and NextGen is a great tool as far as getting the work to the right person quickly so that someone is working any kind of issues you have, getting it to the right team. Review your setups, claim edits, the reason code library, and then the reason code subgroups to help organize your denials. On the claim edits, again, I mentioned this just a little bit ago, look at your rejections from your clearinghouse. What are your daily rejections from the clearinghouse? Can you turn on new claim edits? Can we task from the claim edits? Go ahead. And, I don't know if many of you use, but you can task directly from your claim edits. Now, this is an enterprise preference, so you need to turn it on to have the ability to even see a task. But you can set up tasks, and if you have bundling issues or claim edit issues or diagnosis, send those to your coders. Have them take a look at those before those claims go out the door. Stop them, have the coders look at them. If you've got issues with provider zip code, patient zip codes, demographic issues, force this to a front desk work group, have those cleaned up. So if you're running your claim edits through the BBP, who's looking at your claim edit report? Who's working those red errors that you have? And if it's one person and then they're divvying it out to other people, look at turning on the tasking directly from your claim edits. It'll go right to the right team immediately. And then your reason code library, this is an area that we look at that doesn't get touched as often as it should. Your reason code library is going to drive your ERA posting. It's also going to drive your trending and your ability to send out clean claims and trend what's my problem, what are my denials, what's my top denials in the system, how do I fix this so I have cleaner claims. So your reason code library, you want to make sure that this is as up to date as possible and you're always touching it. Is it adjusting something off the system? I mean, timely filing will come through and the payer's going to say, you timely filing, you're not going to get paid, I'm going to adjust the full amount off the system. Do you want that to auto adjust? Do you want somebody to touch it? Do you want somebody to appeal it first? Non-covered charges. Many times the payers will send these back non-covered and they'll say, just off the full amount you billed. Are you going to bill the patient? Are you going to appeal that? So you want to make sure that you go into each one of these reason codes and you set it up to either skip the adjustment or let it take the adjustment or add a zero adjustment to it. And do I want it to go to appeal? Do I want to force it to patient responsibility? And then this is where we're going to link that reason code subgroup to it so that I can trend it and run reports and say, this is all my non-covered. How do I work to get those covered or get those through the payer without having to appeal them every single time? And then based on this, we can say who and how do we want to work our denials too. So the reason code subgroups help you organize the denials, but it also allows us to trend on the reporting like we talked, but you can also create subgroups for the tasking. So now I can go ahead and say, well, I have my non-covered and my timely filing, and I'm going to send that over to one work group to work. But I have my bundled issues, and I want that to go to my coding team. So I can go ahead and set up a task that as soon as I post my payments and this reason code is attached to it, and I've got that reason code in my subgroup, I can now force it out to a work group so they can start working on that denial within the 24-hour time frame that I'd like. So in summary with this one, and there's a lot of data in here, is run a few key indicator high-level reports and get a quick pulse. Audit regularly. Make sure that you're auditing and looking for missed revenue. Close the gaps. Once you've determined that there are some issues within the system, you've now identified them, close the gaps. Review your processes. What can we do to make us work a little bit smarter and not quite so harder? Review your setup. Within NextGen, there's always changes with every upgrade, and again, we've spent a lot of time with the KBM and the meaningful use and all the upgrades with 8.3, and we continue to work on that. But are we missing revenue on the EPM side? Is there new features and functions in NextGen that we haven't even implemented on the EPM side because we haven't had a chance to test them or run them through? So just review your setup from beginning to end, and then just maximize your automation for efficiency. It's not too late. Take your financial pulse today and get your financial health back on track. And just keep your financial health of your practice as healthy as you keep your patients. Are there any questions?
Thank you so much, Jeannie. That was very good, very insightful. Again, I want to mention that you can enter your questions area in the questions area of the webinar control panel, and we'd be happy to answer them. First question. Will the PowerPoint be sent out? We'd be happy to send you a copy of the presentation if you want to either request it in the questions box here, or else you can check out our website where we're going to post a copy of the recording as well as a copy of the slides, www.itentive.com, and then go to the events and education section of the website, and you'll be able to see all of our past webinars as well as this webinar starting tomorrow afternoon there. I also want to mention that you can follow us on Facebook and Twitter and LinkedIn, and we do send updates of upcoming webinars, past webinars, links to recordings and all of that on all of our social media tools. So please follow us. We'd be happy to interact with you in that way. Okay, and it looks like we have a question here, Jeannie. Can we open up a ticket with Itentive if we need assistance setting up any of these automated processes, or do you have white papers for the setup?
Reach out to me and let me see which area you're looking at. I do not have white papers on each one of them. You know, we do assist in kind of doing this financial overview, coming in and helping you get everything set up if there's areas that you want us to kind of focus on. Chelsea, if you want, we can shoot my email out to them as well too, and if you want to reach out to me and let me know what areas you're looking at needing assistance in.
Absolutely. Do you have anything else to mention while we're waiting for any more questions to roll in?
I don't. That was a lot of information.
It was. I'm still processing it all right now, too. We'll stay on. If you have any more questions, please feel free to type them in the box, or else I will be sending out an email to everybody who attended today, and I'll copy Jeannie on it, so you'll have her email address if you have any questions. You can send them directly to her as well. Thank you so much for taking your time to be with us today. Hope that you found it insightful and informative. Have a great day, Jeannie. Thank you so much.
All right, thank you, everybody. Have a great day.